Just got an order in for a shoulder x-ray on a patient. We're gonna go ahead and get our room all set up and our materials together so that we can get the patient in and out rather quickly. So for the shoulder x-ray, there's about 5 shots. We're gonna do 4 up against the wall bucky here and 1 on the table. So in all cases, we're gonna be using a 10 by 12 IR, and for the table, or for the upright bucky shots, we're going to be doing most of them crosswise. So I'm going to go ahead and put the line towards the right side of the patient as it is an AP shot, and we'll get it ready. So we're going to go ahead and line our tube and our bucky up for the shoulder x-ray. First things first, we want to have a SID between 40 and 48 inches. In this case, I'm about 48 inches away. I'm going to go ahead and turn the light on and move my tube into position. At this point, I'm going to open up my light a little more to calmate the light to the IR size. And we're ready to go ahead and get the patient. Meredith?
Yes.
So my name is Tim. I'll be taking your x-rays today. What is your last name?
Rogers.
And your date of birth?
It's 12/11/83.
Alright. Is there any chance of pregnancy?
No.
Alright. It looks like we're taking some x-rays of your left shoulder today.
Mm-hmm.
Can you give me a backstory? What's been going on?
Yeah, I just joined a softball league and I decided to go sliding into second base.
Head first, I take it.
Yeah.
Okay.
It was second base. It wasn't even home.
Alright. Well, let's get you back and we'll get this going.
Great.
Alright, ma'am, I'm going to go ahead and have you with your back up against the board. Alright, I'm going to just put this protective barrier around your waist. I'm going to have you take a step to your right. Alright, I'm going to have the central array for the internal rotation perpendicularly shooting 1 inch inferior to a coracoid process of your scapula. Ma'am, I'm going to have you take your hand. I'm just going to have you put the back of it up against your wrist. Alright? Perfect. Go ahead and hold still. For our shoulder, we're going to want a KV of 80. And our mass is going to be at about 20. Going to have the patient hold still for the x-ray. Ma'am, can you please hold still? Alright, you can relax. Alright, good. Perfect. Going to take out this IR that's exposed. Get my other IR, put it in. Alright, ma'am, for the last one, I'm just going to have you rotate your hand around. Alright, perfect. Make sure that I still have my central array coming in 1 inch beneath her coracoid process. Go ahead and hold still. For our shoulder, we're going to want a KV of 80. And our mass is going to be at about 20. Going to have the patient hold still for the x-ray. Ma'am, can you please hold still? Alright, you can relax. Good. Thank you. I'm going to go ahead and take this IR that's exposed, put in my next IR. Alright, ma'am, for this next one, I'm just going to have you rest your hand up against your side. Just keep it normal like you're relaxing. Alright, perfect. Hold still. For our shoulder, we're going to want a KV of 80. And our mass is going to be at about 20. Going to have the patient hold still for the x-ray. Ma'am, can you please hold still? Alright, you can relax. Good. Alright, take out my exposed IR. For this next one, I'm going to take the same IR, 10 by 12, but this time I'm going to put it in lengthwise. I want to make sure that I recollimate I'm going to have you flip around for me. Just turn all the way around. Okay, so for this last view of the shoulder, I'm going to have the patient with their affected shoulder up against the IR. They'll be obliquely rotated about 45 to 60 degrees. The goal here is to line up the side of the scapula with the humerus with the central ray shooting perpendicularly at the shoulder joint. So I'm going to go ahead and feel for your scapula. There we go, and your shoulder. Alright. So here, move my marker over, still the left shoulder. I'm going to go ahead and shoot this x-ray. So our Y view of the shoulder is going to be about the same kV as our others, as 80. But we're going to bump our mass up to about 35. I'm going to go ahead and give the patient their instructions. Ma'am, please hold still. You can go ahead and relax. So for this last projection, we're having the patient sit towards the end of the table. The IR is still a 10 by 12, and it is towards the end of the table as well. The patient is taking their affected shoulder and leaning over the IR. The angle of the x-ray itself is facing 5 to 15 degrees away from the midline of the patient, with the beam entering at the level of the shoulder joint. The patient's head is turned away from the beam and tilted out of the way. So I'm just going to have them hold still as I take the x-ray. So our last shoulder is the superior-inferior shot of the shoulder. So we'll be using a kV of about 80 and a mass of about 20. I'm going to go ahead and give the patient their instructions. Ma'am, go ahead and hold still. You can relax. So we have our exposed film of one of our shoulder x-rays. We're going to go ahead and place it into the IR reader. After it is placed in there, in a few seconds it'll appear on the screen and we can look at the image that we took. For all of the shoulder x-rays, you want to see the superior scapula, the lateral half of the clavicle, and the proximal humerus. For an external rotation, you want to see the humeral head in profile, the greater tubercle on the lateral aspect of the humerus, the scapulohumeral joint with overlap of the humeral head, and an outline of the lesser tubercle. On a neutral rotation, you want to see the greater tubercle partially superimposed, the humeral head in partial profile, and a slight overlap of the humeral head and glenoid cavity. For the internal rotation, the lesser tubercle is in profile on the medial side. You can see the outline of the greater tubercle, and there's more of an overlap of the humeral head and glenoid cavity. For the supero-inferior axial projection of the shoulder, what you need to see is the scapulohumeral joint open, the coracoid process above the clavicle, the lesser tubercle in profile, and the AC joint through the humeral head. For the Y view x-ray of the shoulder, you want to see the humeral head and glenoid cavity superimposed. The humeral shaft in the scapular body also superimposed. The scapula is out of the line of the thorax. You want to see the acromial projected laterally and the coracoid projected medially. And the scapula will be in the lateral position.